Alright, you ready? Page 611 on the right hand side. Okay, client education. These are the direct actions that are typically answers for what should the client do, or what should you teach the client, or what indicates the client understood the teaching. These are the answers right in your situation. Avoid crowds or countries with poor sanitation, right? Because again, they're more exposed to bacteria. Avoid raw fruits or veggies. Yes, this means to cook fruits and veggies. Huh? Boil it. And I usually get the response too, they're like, well, we've never cooked fruit or this and that. It's like, well, you're not immunocompromised. That's good.
So like you just boil it?
You boil it.
And you get soggy?
Or bake it.
So like an apple.
You just boil the apple or bake it. Alright, listen up. Y'all ready? The question or your concern is obviously weird because again, you don't do this, do you? Are you immunocompromised?
No.
So of course you don't do this. You do this for people who are extremely immunocompromised. Fruits and vegetables have bacteria or other things on them. It's not unorthodox to cook it. You eat it all the time. You've ate an apple pie, I assume?
Right.
It's a baked apple, yes or no?
Yes.
But that's a.
Did you pick broccoli and you start eating it like a rabbit? You cooked it, didn't you?
Sometimes.
Did you steam it or did you bake it? You did one or the other. So when you're looking at me like this, it's you.
It's you.
I'm gonna go boil the apple and I go like this. I got one over
So, do we understand? Most vegetables you either steam or bake. No one here is insane. You cook it all the time. Okay? You could eat raw veggies. But let's be real, who here is eating raw veggies?
Right.
Because it don't look like it. Alright, on a serious note, cooked fruits and vegetables, usually that's the answer, like that. Cooked fruits and vegetables. Now, undercooked foods. This one's a little bit more particular. It tends not to say that. What are examples of undercooked foods? Sushi. Rare, medium rare, or rare steak. Beef tartar. Or tartare, how do you say it?
Beef tartare.
Tartar.
Actually, it's amazing. Caviar.
What about eggs?
Yeah.
People eat undercooked eggs, right? Over easy, sunny side up, soft boiled. When it's runny. Yeah, when it's raw because it's not fully cooked through. Caviar, right? These are undercooked foods. Yes?
Yeah.
Ceviche.
What about kombucha?
Huh?
Kombucha.
I don't know. I honestly don't know. Yes? Alright, fire down so we can continue. Don't clean pet litter boxes. Specifically, right, litter boxes are used for cats. And their droppings and the litter tends to contain toxoplasmosis. So generally, to most people, not a problem. But to immunocompromised, it can. And on top of that, pregnant women. If they get toxoplasmosis, the fetus will come out deformed or dead. So you gotta make sure that when you're pregnant and you have cats, you're not the one doing the cleaning or around them. Wash dishes with hot water. The other one is, listen not. The other one is, cleaning their toothbrush. How should they clean it?
Put it in.
Dishwasher.
Dishwasher, or hot water, or hydrogen peroxide solution.
Yeah, that's the dishwasher.
Bathe daily, antibacterial soap. Make sure they have frequent follow-up visits to their doctor. And make sure they report manifestations of infection, which again are always fever and sore throat. Okay, that means there's an infection. So those are the common ones. Please be familiar with the foods and or actions they have to do. It goes without saying, avoid again the right, like crowds or people that are sick, people who are, coughing or have symptoms of the flu, they should avoid. Yes? Okay. You ready for the next one?
Mm-hmm.
Okay. Now, these are a list of the most common opportunistic infections. Tuberculosis. Tuberculosis, even if you get exposed to it, most people manage it on their own. If it becomes active, you take medication. But tuberculosis is generally not even a problem until your immune system's weak. So, if they have tuberculosis, pneumonia, or Girovechi pneumonia, candidiasis, that's a fungal infection. You could even see it as thrush, right, on their mouth. So something that's a common action that you do for these types of patients is you tell them to check their mouth, open their mouth, and you check for, right, what does candidiasis look like? What would it be described as? White, cottage cheese-like, or churn-like, right? Hodgkin's, non-Hodgkin's lymphoma, and you'll see that their lymph nodes are usually swollen. These are common, more opportunistic infections. So if they have these present, what is the diagnosis now? AIDS.
Even if they're not stage 4.
Okay? These medications are found, these opportunistic infections are found in the beginning of the chapter, and then they label them again on the top of page 612. It says complications. So be familiar with your opportunistic infections, because should you be asked, which ones are they? Common list of the ones that are listed on there. Yes? Okay. Next one. Wasting syndrome. Okay, you don't eat, you have poor appetite, poor intake. This often is also, by the way, in conjunction, not that the disease is just making that to them, but the depression and the stigma that comes along with it. People are mentally and emotionally broken with the diagnosis, and with their health depleting, it's more likely that they turn to just not eat, they lose appetite, they have anorexia, and so then hence they will start wasting away. Okay? So monitor their weight, calorie count to make sure they're taking in enough, rinse their mouth frequently. With clean mouth, they usually have more of an appetite. Small frequent meals. They might not be able to take in a whole meal, but have a few bites here and there. And the last one that I just put on there was, if you look all the way down, if the HIV gets bad enough, it can cause encephalopathy, which means like a disease of the brain. It's affecting the brain and can cause seizures. So if they're developed HIV encephalopathy, you have to put seizure precautions. Padded rails, rails up, okay, suction at the bedside, oxygen. We talked about the stages. You have to be familiar with your stages and what are the defining characteristics, which is the CD4 count. Stage 1, 2, and 3. There's a fourth, this is no information available, so.
What does that mean?
Not entirely sure. Stage 1 is when you're still over 500 cc's. Well, symptoms. Between 2 to 499. Okay? So another patient teaching, we went over labs, quantification, tropism, okay? So that we make sure for drug resistance, viral load. We also went over screening testing. We also went over confirmation of the diagnosis, so with the Western blot. Okay, so make sure you know head to toe for HIV. What causes it, risk factors, spread, what are the body fluids? Vaginal secretions, semen,
Are we doing all of them or just the top one?
blood, transmissible, that's transmissible, one more.
Breast milk.
Shared needle.
Shared needles is blood. That's still blood. It's which bodily fluid is gonna make it spread? Urine.
Spit.
Not saliva.
Breast.
Breast milk.
Shut up. You don't hear me.
Speak up. This is your sign for you to speak up for yourself. Now, saliva can't spread it,
It's good.
but you would have to drink you would have to drink about a tubful, I think, or it's like a pool, or it's like a pool of spit in less than 20 minutes or like an hour, something like that.
God damn. I wonder how they got on the stick.
Yeah, that's how much you would have to do to have a significant amount of exposure that you can get it. Yeah, that you can get it. So, hence, you can find it in certain bodily fluids, also in cerebrospinal fluid, feces,
They said
things like
sweaty.
that, but these are not significant sources of
Oh, yeah.
infection.
So it's just not concentrated in those areas.
Right.
Oh. It doesn't say breast milk.
Alright, real quick, quiet down. People got questions? And what I want to ask them, so back to the whole thing. It has to do with concentration, okay? In certain areas of the body, it's just not concentrated enough to be able to be transmissible. We also, was mentioned earlier about what is it, something that goes around as being mentioned, and it's been around forever, obviously, but it's a lot more common now, is when they say that they are undetectable, okay? And you will often see this around a lot, like as advertising kind of. It's like the hallmark of advertising, but if you read it, usually explains it. But there's a big thing that goes around, like they always slogan it, where it's undetectable, untransmissible. Okay? So, what does undetectable mean? This is usually when your viral load is so low that the test, the quantification, can't pick it up. It can't pick up a reading, and or the reading for a lot of places is something like 30 or 40 copies per millimeter that they do it. So it's so low that it can barely pick it up or not pick it up. So when you're below this many copies, or it literally doesn't detect it, then you are given the status of undetectable. If your viral load is this much, if you're in undetectable status, by definition, you are untransmissible, meaning you cannot spread it through sexual practices, let's say, or interaction, sexual intercourse. Because again, the concentration is, and or ability of it is so low. Yes.
I was literally gonna ask that. Like, is it same?
It's just the
rest
same,
of
there's not enough concentration, and arguably, again, it's because of the medication you're taking and the virus's status. Yes.
So is that the same for like when someone is like, they may have it and they don't know it?
It can be, but no. Usually, if you don't know it, you're still spreading it.
Oh, okay.
Because there's no way you're gonna be undetectable without medication. You might not just have, you just might not have, you don't feel the symptoms, but that doesn't mean your viral load is low.
Oh.
It just means you're not manifesting. Okay? Yes.
So when you say concentration, obviously it's not like you sit in the water, how much concentration, I mean, besides the bucket full of spit?
So, that's the spit one is just a fun fact that I had
Yeah.
read, but for this one, that's the concentration. I forgot how they measure it. I forget if it's per millimeter squared is usually a good one of blood. So that you don't need to know per se, and you don't need to know this. Just know undetectable. They won't ask you for specifics unless you're working for, like, again, somewhere like that. The term that you should be familiar with is undetectable, and you should know this implies their viral load is so low, it's not detectable. At this level, they are likely to not transmit it through sexual intercourse. Yes.
This one says, fewer than 50 copies of HIV per millimeter of blood.
So this differs, just like any other level, at every hospital. Yes. So, another question. Would the Western blot come out positive if they were to take it now? If they take a Western blot, would they still come out positive?
Yes.
Okay. The answer is yes. What do many tests measure?
If there's antibodies.
If there's antibodies, most tests to diagnose diseases measure antibodies. That's what we learned about it. So, if you have the flu, your body, I'm gonna use the flu as an example because the flu actually measures for the virus. But let's actually use HIV. So the screening test, for example, or the Western blot, is what it can do. Or for tuberculosis, the PPD, what it's measuring is your body's response. So, if you have HIV, your body will produce HIV antibodies. Remember that antibodies is anything that's gonna fight that particular disease. So, if your body, if your organism has never had interaction, has never been exposed to HIV, how could your body possibly develop a response to it? Your body, your B cells are only gonna hold on if you have ever been sick or exposed to something. If you've never had the flu, you can't have flu antibodies. Your body has never come in contact with it. So how could you possibly have it? Does that make sense? So most tests, not all, but a lot of diagnostic tests measure the presence of antibodies. Because if you have antibodies, you've been exposed. There's no other way. How could your body possibly have learned that response if you don't have it? There's no way. So most tests measure antibodies, not actual viral or anything other load. Viral load is used for what? For HIV. To check what?
Don't know.
Therapy effectiveness. If you have 400,000, 200,000 copies, 20,000, 50,000, any amount, and we start giving you medication, how do we know it's working?
It goes down.
It would go down. How do you know it's not working? It goes up or stays the same, or not, it's not going down significantly. So it's not as effective. Viral load is used to measure effectiveness and track your progress, whether you're still maintaining a detectable status. That's the point of it. But that doesn't prove the whole HIV thing. They have to use a Western blot. Because you might be undetectable if you just got it, but a Western blot will tell you whether you've already been exposed and you have it. Make sense? So a lot of tests are like that. PPDs, for tuberculosis, you'll have a reaction that you couldn't have unless you've been exposed to tuberculosis. Make sense? So a lot of tests measure, what's it called? Antibodies, not the presence of virus itself. Okay? Undetectable equals untransmissible is a new thing now, or again, it's more vocal now, but it's been around for a while. Low viral load. They don't really pass it on to people, especially through common body fluids like semen and or vaginal secretions. And lastly, as well, something else that gets asked is people ask about PrEP, which is pre-exposure prophylaxis. So being pre-exposure, prophylaxis means right like ahead of time, is they take this medication, and this medication helps prevent the infection. You cannot cure it. Remember that HIV is not curable. They help prevent infection. Okay? So, the idea behind this is you're HIV negative, you're taking PrEP, and should you have sex with or interact with somebody that has HIV, you are less likely to get it. I think that if the person is not treated, like the HIV positive person is not in treatment, not taking antiretrovirals, and you're taking PrEP, I think it reduces it by something like 80% was what I heard a couple years ago, something when I first started. It's right, and then if they are on antiretroviral therapy themselves, and you're taking PrEP, it's something like 99.99, like, it's not gonna happen. Now, again, in reading up and doing research papers and whatnot, big European studies with thousands of couples, I think it was something like 2,000 or 4,000 couples, like that were monitored over the case of like 5 years, was studied, and this was both heterosexual and homosexual couples, were followed for I think about 5 years while they were doing an undetectable, while they were maintaining an undetectable status. And during those 5 years, 0 couples spread it to their partners as long as they maintained undetectable status. Okay? So a lot of that is coming from, again, it was studied, seeing how much of effect it was, the therapy. Arguably in the last 20 years, a lot of progress has been made for HIV in like those super blowing up magazines. Arguably it's been, they don't use the definition cure, but the person had just recently been infected, and they think they did like a transplant, like a bone marrow transplant, and they were able to reverse it. So what it was a here piece side is that. Okay, so there's a lot of positive progress that's made on a lot of disease fronts either way. So it matters. When you see, like, look at breast cancer now, well, before it was so deadly, and to this day some versions of it still are, there is a lot of prevention. There's more screening. So does that mean that cancer is cured? No. Not necessarily, but the treatment availability for it and the amount of times that it is curable is so significant. So it does matter, because at the end of the day, what really gets these things going is money.
No one wants to cure shit, and they won't need money.
Not so much that, but I don't know about you, I don't go around caring to cure any of the diseases unless they personally affect me. So there's conspiracy theory, and then there's also just a simple fact that people who are out selling tires are not necessarily trying to cure cancer, because why would they? That's weird. If you're just randomly like, you know what, I'm just gonna start funding, I'm just gonna spend my entire fortune on something that doesn't even matter to me at all. I don't do that. I don't know about you. Nobody does that. Hence, the arbitrary thing of this was, you guys know this company? This owner is one of the richest men in the entire world. He has become a monster financially. And he got diagnosed with one of the rarest possible cancers ever existed.
And then you got a shit ton of funding.
And now they're on the verge of a cure because he dumped like something like $200 million to fund research. And now, as you progress into more research yourself, or as you go into higher degrees, if you do, listen up. Only a few, I think it's something like dozens, or only a few like dozens of people get diagnosed with the cancer like yearly. It's so low, and it's on the verge of like having so much more treatment available and everything? Because he funded it.
Which cancer?
So, just look up the owner, you'll figure it out. There's the article, as long as you look up the owner, you'll just put cancer, like, put in his name cancer, you'll see the article. So, this poses a dilemma, because it's like, who should get, like, who determines what gets cured and what doesn't? Make sense? He could have done this for breast cancer, right? For colon cancer, for something that's more prevalent and have helped more people, but instead,
He cares about that.
exactly. So that's the point of it. No one's gonna fund stuff that they don't care
But
about.
like also money too.
It costs more money to treat cancer than anything.
Cost, but not to the people who make the med. That's what I'm saying. The people who make the med.
But the same people that are, you're saying that are making money are the ones that are spending it. Exactly, there's that too. They die. You're making no money off of it.
No. But like you see, the medication keeps them alive a long time without curing.
If you look at the statistics realistically and not from an Instagram point of view,
It's not Instagram
somebody
point.
hiding a cure is costing
Oh,
more
I
money
didn't say
than
hiding
curing.
here. I said just not funded. Not funding, just keep making the pills to change it.
Yeah, it's more interest, bro, trust. You're like grasping a conspiracy. Alright. Yes.
I actually don't really know much about PrEP. How come we don't learn about it in school as nurses? Like, I feel like it's a common thing now.
What?
PrEP. Like, PrEP itself, like, why don't we learn about it, like, part of pharma or anything?
I think because one, the medications that you are learning for HIV are used for PrEP. It's not a separate medication. It can also be used to treat it. So, I think at first, one of the first PrEP ones was, Truvada was the first one. I'm not sure if that's the generic name, because Truvada's a brand name if I'm not mistaken. And then currently it's Biktarvy's being used now? Oh, this is to treat it. I'm not sure which one's using, but some of them can be used interchangeably for PrEP and for treatment. So if you learn about the treatment, I mean, the PrEP is there. It is not significant. Remember that your NCLEX focuses on safety, competence, and stressed about it is hypertension, diabetes, chronic kidney failure, or kidney disease. Because this is what you will see most on the outside, on the field. Insulin poses its threat. You know, you can kill people with insulin. Metformin, if you develop lactic acidosis, that's what you're worried about. Like, they test you on the safety, can you watch out for the danger? Not so much on, people come on, they're like, I didn't know how to work. It's like, well, that's not, you'll get trained there. But can you have the safety mindset? Is the goal here. Make sense? Any questions? Any questions on tomorrow's quiz? HIV and gout will be when? On the exam the following week. Rheumatoid, SLE, and last week, tomorrow. Yes?
So Miss Ariane.
SL. SL.
Miss Ina will be here tomorrow. Miss Ariane will be here the next week for both days.